Let's talk about anxiety. Hello, everyone. Welcome to the channel. I'm Dr. Noble, developmental behavioral pediatrician and clinical geneticist, and today we're talking about anxiety. If you're watching this video, it's because it's you or more likely a kid who's struggling with going back to school and what that looks like and how that feels and tastes. If I'm getting one question in the clinic over and over and over again in this season, it's what do we do with anxiety? I'm going to tell you what I say to all these families and more in this video. Let's get after it. The first thing we have to think about when it comes to anxiety in children is we can't really jump into action steps until we change your operating system, okay? This is such an important endeavor when I work with parents and families because we have to change the way you understand this. And some of the things I'm going to talk about in the next few minutes may not be useful to many of you watching this video, but some of you are going to get a tremendous amount of benefit from learning to change your operating system before you begin to address the anxiety that your child is experiencing this fall. The first way to change the operating system is what I call swimming with sharks, okay? And it doesn't mean what you think. One time, I'm out to dinner with my brother, and he's a great guy. And he brings a friend of his from college, and we're having dinner, and the guy says, I've climbed all these mountains, and I've ridden motorcycles, and I've thrown knives, and I've said naughty words, and I've cut the label off mattresses. It's kind of giving us this laundry list of all these kind of brave things that he's done. And then he says, and then when I went to Australia, I swam with sharks. And I'm like eating a hamburger, and I'm like, what? You swam with sharks? He's like, yeah, I swam with sharks. And I thought to myself, wow, this guy's really brave. Like all that other stuff wasn't that impressive, but swimming with sharks is brave. Listen, the reason we start with this in terms of challenging your operating system is that we have to understand, okay, that bravery is not measured by what you do. It's measured by what you overcome to do what you do, okay? And kids with anxiety are super brave. Just hear me out. The reason why we have to change this operating system is because it's easy to see kids who have anxiety-mediated concerns as anything else but brave. And the truth is, they're incredibly brave because what this guy had to overcome to get into a tank with a bunch of sharks and cut the labels off a bunch of mattresses and be a real tough guy and, get a cool tattoo or whatever. What he had to overcome to do that was minuscule in comparison to what your child or children like you have to overcome on a daily basis to get out of bed, to get dressed, to get on the bus, to go to school, to say hello, to sit at the lunchroom, to deal with all the sensory inputs in their environment, to deal with homework and to raise their hand and do all the things, right? It's the same as swimming with sharks to these kids. These kids are not weak or fragile or broken. They are brave, brave people, and our operating system has to start here. The second challenge to your operating system is a simple statement. Listen, it's easy to be mad at someone who's being mean to you. Okay, think about when you've been cut off driving a car to work, or when someone said a rude comment to you in the supermarket, or whatever it is. It's easy to be mad when people are mean, but it's harder to be mad at somebody, not because they're mean, but because it's easier to be mad at someone when they're being mean. It's harder to be mad at someone when they're afraid. And the hard thing is about this, they often look the same. They can look the same. People can be super mad and people can be super mean and they can be super afraid, and sometimes their behaviors can look similar to each other. But if you can reframe your operating system to understand that if your child is explosive, if they don't want to go to school, if they're refractory to transitions, or they don't want the new input, or they don't want to make the necessary next steps in their life, it's very easy from a parenting perspective to be angry or frustrated when you perceive those behaviors as being mean. But in actuality, they're acting from a place of fear. And if you understand that from an operating system perspective, it softens how you interact with these kids. They're working through it, right? They're getting ready to jump into a tank with sharks, and there is a fear element that must be navigated. And understanding this softens how you approach them. The third thing I want to challenge your operating system with is that it's okay. Can I just hear me out? It's okay for children to be uncomfortable. I know. Sometimes when we've got kids who are navigating anxiety, again, we want to be sensitive, we want to be kind, we want to be patient, right? We want to acknowledge the bravery that they're approaching a situation with. But we also simultaneously have to understand that anxiety in and of itself doesn't give your child an opportunity to avoid all things things that make them uncomfortable. And we have to acknowledge that as part of our operating system, that discomfort does not mean disqualification. All right. If they're uncomfortable with a certain situation, that doesn't necessarily mean that we should avoid it at all costs. Now, should you go bungee jumping? Okay, if that's uncomfortable for them, they're not into it. Yeah, maybe skip that one. Should you, get their ears pierced, or should you ride a roller coaster? You can figure that out on your own. But some transitions are not necessary. Okay, but other transitions that can lead to discomfort, like going to school, meeting new friends, showing everybody how amazing you are, those things can lead to discomfort, and those are situations that are worth pressing into and pushing through. Lastly, the last challenge to your operating system, before we get into the specifics on how to help your child navigate anxiety, this fall is based around the idea of alchemy is this scientific system where you take one thing and you change it into something else based on the similarity between the two substances. Fritz Perls is the father of Gestalt therapy, and I think he described anxiety and fear best when he said this: fear is excitement without breath. My point here with alchemy is that anxiety, fear, stress in the new, right, the discomfort of all the things coming up, there's a lot of alchemy here where it's actually fear is very closely related to excitement. Fear is very closely related to breakthrough. Anxiety and excitement are very closely related, and they're not diametrically opposed. They're not far apart. And sometimes navigating that discomfort and leaning into the necessary alchemy to see one thing change into another thing is worth it to you. And that's how, and understanding these things is how you're going to do. And understanding these basic operating system challenges is how you're going to proceed with the things I'm about to tell you next. So now I'd like to give you 8 tips that I share with families over the last 20 years of doing developmental behavioral pediatrics to help them successfully navigate the stressors and challenges of new situations, of new school years, and of all things discomfort. First and foremost, if your child hasn't started school, I would advise you to visit the school in advance, right? Things that you're familiar with, you're less anxious about. Familiarity kind of can lower to some extent the anxiety that a child may feel about a new classroom, or the way it smells, or the way the lights feel, or where I sit. If you can visit a school in advance and get a sense for the lay of the land, your child will most likely your child will more quickly be able to overcome the anxiety of this new situation. So visit the school in advance. Number 2, practice going through the motions, right? Whether it's a summer camp or a weekend trip or starting a new school year, practice. Practice getting up on time, practice getting yourself dressed, practice picking out the clothes beforehand, practice making breakfast, practice standing on the curb waiting for the bus. Practice those things. Walk through those steps. Set the schedule up in advance and work the steps. I promise you it will decrease the anxiety and newness of the situation that's causing discomfort. Number 3, anticipate schedule changes and anticipate accordingly, right? As much as you practice, as much as you go through the schedules, as much as you kind of build this cognitive map in your head about how things should work and what things are going to look like, there are variations to the plan. I mean, think about today. You're watching a video, but how many things today did not go according to plan? Lots of things. So sometimes there's an assembly. Sometimes there's a fire drill. Sometimes it's raining and you can't go outside. You have to practice putting these wrenches into the schedule and the routine in order to ensure that your child can figure out how to cognitively accommodate unanticipated changes by practicing as many different outcomes as you possibly can. Now, this is hard, and I understand it, but really what we're trying to do is take a steel pipe and make it a pipe cleaner, right? Steel pipes are not flexible, right? There's not a lot of movement with a steel pipe, but a pipe cleaner, right? Those little fuzzy things, those little things you make all kinds of cool crafts with, those things are bendable. We're trying to introduce the idea of cognitive flexibility into your child's mindset so that they can take the changes that come and navigate through them accordingly. Number 4, think about social stories. Now, we talked earlier about walking through the steps, packing the bag, getting yourself ready. That's the actual physical steps necessary to prepare you for an upcoming transition or change. But what we're talking about now is essentially creating a cognitive map. So you're going to tell your child, you're going to work with your child to create a social story. Today I got up early, I got ready, I did the things I needed to do. I got on the bus, I sat by the window, or I sat by the aisle. Sometimes I sit in different places, and that's okay. I got to school and there was lots of noise, and that's okay because everyone was having a good time, and I got to my place on time, and I sat down and I was ready to learn. So essentially what you're doing is you're writing that out. Okay, you're reading it back. You're stating it back. Maybe even record it into your phone and you play it back through the speakers in your car, every day for a few weeks before school starts. You're just kind of laying a cognitive roadmap for your child. It essentially becomes a foundational system that they can defer to as they prepare for each day, which will in turn lessen the stress that they're feeling. Next up, contingency plans. As we've said earlier, things don't go as planned, and you can work those things in as best you can, but sometimes things come up that you couldn't have planned for, and we need to practice what we're going to do if we're feeling overwhelmed. So maybe you equip your child to raise their hand, or to stand up and give us a note to the teacher, or maybe you equip them with a catchphrase or some kind of word or a request that they can make that sends the message to the teacher or to the school, that sends a message to the teacher or the staff that indicates, I'm overwhelmed in this situation, I need to take a quick break. And maybe they go get a drink, or they go to the bathroom, or they just go out in the hallway and take a few deep breaths and work on some exercises. Those are the kinds of things we have to introduce into the system to ensure that your child can be adaptable when contingency plans are necessary. Now, for some of you, you're watching this and anxiety has led to behavioral difficulties in your child, and you're thinking, well, maybe we need to treat anxiety, and this is all fine and good, but Johnny still comes home and creates a havoc in our home by making remarkably poor choices. Well, if that's you, I really do think you could benefit greatly from participating in our How to Parent Like a Pro Wrestler class. If there is any group of people on the planet who know how to parent and parent effect utilizing the strategies of behavioral psychology, it's pro wrestlers. If you'd like to know the pro wrestler secrets to being an effective and efficient parent, then join us on September 15th, 16th, and 17th. It's a live event. You register on the website. I'll put the link below. I would encourage you to jump in. Those slots are limited. It's entertaining, it's insightful, it's an amalgamation of all the things I've learned with working with behavioral psychologists and doing this work for 20 years. I promise there's going to be some utility in there for you to help address your child's behaviors today. So jump on that link. We do it once a month. The next one happens September 15th. It starts at 7 p.m. Central, and again, spots are limited, so jump in. I promise you, you're going to love it. Okay, now back to the video. Next up, talk to the school. If you've got a child who has an impairing form of anxiety, right? It's problematic. You've worked the steps. You've maybe getting some talk therapy. You've gone through the motions. Maybe your child's on a medication. Maybe they're not. And you know that this is likely going to create some conflict and difficulty for the child at school, irregardless of how well you've prepared. At this point in the journey, it's probably best to talk to the school. My oldest son has Tourette syndrome, and I waited so long to talk to the school. I mean, because I didn't want to put a name to it. Do you know what I mean? Your child has a name, right? They woke up this morning, they had cereal, or they went outside, or they jumped on the trampoline. They had a name, and it was a beautiful name. It was a great name. It was Ben or Bob or Joey or Susanna. It was a great name, right? And sometimes when we lead conversations with a diagnosis, with a DSM-5 criteria kind of description, sometimes the name gets lost in the shuffle. So I put talking to the school about diagnoses towards the end of my list today, because I want to encourage you to work the steps. But sometimes visiting the school and putting a name to it really provides a level of clarity for the school. They're less likely to be frustrated, right? Because they're understanding that I'm not seeing somebody who's being mean. I'm seeing somebody who's afraid, right? It's softening the blow. It's giving them insight. It often also opens up an opportunity for you to equip and encourage schools on how best to navigate this situation, and even begin to fuel school supports like a 504 plan or an IEP, which I'll link those videos below. If you don't know what those are, I've done videos on those in the past. I'll link them below. Next up, diet and exercise. Okay, yes, of course. We want to avoid all the preservatives and dyes and all the stuff. But listen, if your kid is struggling and is tied up and anxious, they need to get exercise. They need to move their bones. Get them out there, get moving. I don't care if it's a trampoline. I don't care if it's a slip and slide. I don't care if it's a bike ride, right? Wind on the face, sun on the skin, a little sweat. These things can do a remarkable amount to decrease the level of anxiety that people are feeling and then diet, right? I know it sounds strange to think they're linked, but it's true. Like giving healthy choices, advocating for a diverse food intake, giving your kids opportunities to grow in their sensory palette of what they will and won't eat. These things can all work in synchrony to help kind of minimize or decrease the anxiety a child is feeling. Next up, let's talk about counseling. As we get to the end of our list here, we're getting more medical now. Now, oftentimes when I see kids in the clinic and we've verified the presence of a clinically significant anxiety, it's usually the first place to start is to have them connected with a talk therapist, okay? And I use the term talk therapy because it means a lot of different things. Sometimes it's a social worker, sometimes it's a psychologist, sometimes it's a marriage and family therapist. There are just a lot of people who do talk therapy. And I put it lower in the list, not because it's not valuable, it's super valuable. But it's hard to find people, right, who are accessible and who can connect with your child. And so if you have the ability to do this, sometimes they require a referral from your primary care provider. Sometimes you can just call these offices and make a request yourself. Sometimes there's no therapist in your community, but you do have a psychologist at school. And so then you can talk to the school and say, is there any way that we can meet, that my child can meet with you once a week or once a month and just go through some of these strategies to try and calm our body and get insight into what we're feeling and what's real versus what we feel. Those kinds of things are usually, from a medical perspective, those are the best places to start, right? Start with talk therapy, somebody who is able to connect with your child and provide meaningful input. Next up, we get even more medical. Sometimes kids, okay, now don't get mad at me. Sometimes kids have such paralyzing and problematic anxiety that they need all the things we've talked about already. They need the talk therapy, they need all the different things that we've done, but they also aren't making the anticipated progress, and their life is, you know what it is? It's shrinking. It's like children with problematic or impairing anxiety. Think about it like a box that shrinks on itself. Like these children, like their reality gets tighter and tighter. Or think about it like a backpack full of rocks, and every day somebody puts a few more rocks in their bag, and they have to navigate the same reality that you and I navigate. Oh, they're carrying 60 pounds of rocks in their bag. These kids feel gravity more than we do, okay? It's heavier for them. And sometimes when that happens and they're not doing the things they would normally do, they don't have that zip in their step. They're not participating in the activities that previously gave them joy. You can see that box shrinking. Sometimes they need to see a physician or a provider. Sometimes they need to see a provider to think about medications. And that's kind of beyond the scope of what we're talking about today. But if you want to hear more about what medications, how they work, and what kind of outcomes you can expect, drop a comment below, and we can certainly make videos to talk a little bit more specifically about how we handled that in our clinic and in ways that you could potentially talk to your primary care provider about that. But please know that our goal is not to put kids on medicines. Not at all. We want to clear up all the other things. We want to change the operating system and set kids up to be successful in the school environment. Just every step of the way, set these kids up to be successful. But sometimes all of those steps, in spite of your best efforts, they're not enough. And then you need to think about trying a medication, right? These medications in general can be very effective and are generally very safe, but they're made in a laboratory, right? So there are side effects. There are things to think about, okay? And we need to have that. You need to have that conversation with your primary care provider. But sometimes those interventions are necessary. And if that's where your child is at, please don't feel bad about it. Oh, for crying out loud, don't read comments below this and be like, people who put their kids on medicines, blah, blah, blah. Listen, those people aren't living your life. Okay, they're not living your life. They don't know what it's like to be you, and you've got to give yourself some grace because you're doing the very best you can for your child. So be nice to yourself. Last thing I want to say in regards to interventions to help children with anxiety is what we're going to call the wheelbarrow approach. Now, sometimes, in spite of all the things that we've talked about, your child still believes in some way, shape, or form, in some alternate reality, that the necessary transitions of life are debatable. Okay? Pants are debatable. School's debatable. Nutrition's debatable. Seatbelts are debatable because they make them uncomfortable. This is where we enter in with the wheelbarrow approach. Remember what I told you earlier? It's okay for kids to be uncomfortable if what is on the other side of this difficult transition is necessary. Going to the dentist, wearing a seatbelt, going to school, whatever it is, okay, whatever it is for your family. If you deem it to be necessary, their discomfort is not the most important thing. And then we implement the wheelbarrow approach, where we say to the child, listen, we've done all the steps. We've created the cognitive map. We've prepared in advance. We've seen the talk therapist. We're on an anxiety medication or whatever it is for you. We've talked to the school. And it's not a question about if you're going to go to school or if you're going to go to the thing. It's not a question about if you're going to wear your seatbelt or if you're going to wear a helmet. It's not a question. That's the wrong question. The question is not if, it's how. How would you like to go to school? Would you like to walk into the school building, or would you like to be carried in by a wheelbarrow and then dumped in the foyer? Because please remember, lovely cherub children, that what's up for debate here is not if you're going to go to school, it's how. And once you break the glass, okay, once you get through the difficult transition and the child realizes that they can survive on the other side of whatever it is that they thought was impossible, the anxiety of overcoming that transition tomorrow diminishes. Now, I'm not trying to be unkind. I'm not trying to be rude. This is a metaphor. Okay, we're not actually taking a wheelbarrow to school, right? But you have to change the narrative or the dialogue away from if you're going to go to school and if you feel anxious about this to how, right? How you're going to go to school and how you're going to overcome that, right? You're going to overcome it. It's not a question of if, it's a question of how you would like to do that, because make no mistake, this transition is happening. I hope this is helpful. There's a lot more to say. Join us for How to Parent Like a Pro Wrestler, September 15th. I promise you're going to love it. It goes from the 15th to the 17th, 7 p.m. Central Standard Time. I'll put the link below. Come and join us for that event, and I'll see you in the next video.